Hi everyone. So today's topic is acute suppurative otitis media (ASOM). So ASOM is an acute inflammation of middle ear cleft. So we already saw in last video what is middle ear cleft. So if there is an acute inflammation in the middle ear cleft, it is called as acute suppurative otitis media. So let us see etiology. So how is it caused? So it is most common in the infants and children. In the lower socioeconomic status more common. So and then post-viral URTI. So post-viral upper respiratory tract infection. There will be pyogenic organism invasion. So that is the major cause. So under etiology, you have first routes of infection. So how does this organism invade? So one is via eustachian tube, and other is external ear, and third is bloodborne. So it is rare. So but you'll remember eustachian tube. So that is through inside, and then external ear. So these are the two routes of infection major, and bloodborne it's rare. Then you have the predisposing factors. So under predisposing factors, you have recurrent common cold, that is URTI as already mentioned. Then you have measles, diphtheria, whooping cough, adenoid and tonsil infection, chronic rhinitis and sinusitis. Then you have nasal allergy, cleft palate, and tumors of nasopharynx. So these are the some predisposing factors. So what will you remember? URTI, measles, diphtheria, whooping cough, adenoid and tonsil infection, chronic rhinitis and sinusitis, nasal allergy, cleft palate, tumors of nasopharynx. So these are some predisposing factors. So coming to bacteriology, the most common we have three and the others we have three. So let us see what are the most common. It is streptococcus pneumoniae and Haemophilus influenza and Moraxella catarrhalis. So streptococcus pneumoniae, Haemophilus influenza and Moraxella catarrhalis are the most common. Then you have others like Streptococcus pyogenes, Staphylococcus aureus and Pseudomonas aeruginosa. So this was bacteriology. So once you start ASOM, so you'll go for etiology. In etiology, you will write it's most common in infants and children and lower socioeconomic status, most commonly seen post URTI. So first we'll write about the routes of infection, eustachian tube, external ear. Predisposing factors, at least few points from this. URTI, you can write measles, adenoid tonsil infection, rhinitis, sinusitis, nasal allergy, tumors and all. Then you'll go for bacteriology. So this common, you have to remember, that is Streptococcus pneumoniae, Haemophilus influenza, Moraxella catarrhalis. So others also you can remember Streptococcus pyogenes, Staphylococcus aureus, and Pseudomonas. Okay. So now coming to pathology and clinical features, the most important. So there are different stages. So first is stage of tubal occlusion. So what happens in stage of tubal occlusion? So there will be edema plus hyperemia on nasopharyngeal end of eustachian tube. So there is edema and hyperemia on the nasopharyngeal end of eustachian tube. So what will happen? It will block the tube. So then there will be negative intratympanic pressure. So increased negative intratympanic pressure. So this will cause what? Retraction of the tympanic membrane. Okay. So there was edema and hyperemia. So infection. So after infection, there will be some inflammatory reaction like edema, hyperemia. So this will cause what? It will block the tube. So once there is blockage of the tube, there will be negative intratympanic pressure. It will increase. So then that will cause what? Retraction of the tympanic membrane. So what are the symptoms of this stage? So each stage we have symptoms and signs. So the first stage. So how do you know it is in the stage of tubal occlusion? You will have hearing loss, earache, but that is not that much marked. It's not marked. And signs are retracted tympanic membrane, handle of malleus is more horizontal position, and prominence of lateral process of malleus, and loss of light reflex and conductive deafness. So these 3 points you must remember. What are those 3 points? So not three, 4 points. Retracted tympanic membrane, handle of malleus is more horizontal position, prominence of lateral process of malleus, and loss of right reflex. Okay, these 4 points. Tympanic membrane will be retracted, handle of malleus is horizontal, and lateral process of malleus has become prominent, and there is loss of light reflex. And then you can write this conductive deafness also. So this is about stage of tubal occlusion. So it was occluded, intratympanic negative pressure increases, retraction. So these are the points you'll write in first stage. So coming to the second stage, that is stage of pre-suppuration. Okay. So in stage of pre-suppuration, you have, so what happens in pre-suppuration? Prolonged tubal occlusion, invade tympanic membrane, and hyperemia of lining of tympanic membrane. So there was prolonged tubal occlusion. So the tympanic membrane was retracted. So since it is prolonged, there will be hyperemia of lining of tympanic membrane. So tympanic membrane lining is congested now. So what are the symptoms now? Marked throbbing earache. So here in this thing, it was just earache, right? In the stage of tubal occlusion. In stage of pre-suppuration, you have marked earache. Okay. So then you have disturbed sleep. Obviously, if there is ear pain, there will be disturbed sleep, hearing loss, tinnitus, and in children it is more common, right? So they'll have high degree fever and they'll be restless. So these are the symptoms. Coming to signs, tympanic membrane will be red, and tuning fork test. So there you'll find out conductive deafness. So stage of pre-separation, prolonged tubal occlusion will lead to stage of pre-separation. What will happen there? There is hyperemia and congestion. So your symptoms will be throbbing earache will be there, disturbed sleep, hearing loss. So just compare it. There was just earache and hearing loss. So now you'll, that is I mark more. Okay, so throbbing earache. So this will disturb your sleep. There will be hearing loss. In children, there will be high degree fever and restlessness. So signs, there are only two signs. What are the signs? So tympanic membrane is red and conductive deafness is seen. So even there will be retraction of tympanic membrane here also. One extra thing is there is congestion of tympanic membrane. So now coming to the stage 3. So the third stage is stage of suppuration. So you had stage of tubal occlusion, stage of pre-suppuration. So now the third stage is stage of suppuration. So what happens here? There is formation of pus. So you will have, we'll be adding new points. So now here it is, there is formation of pus in the middle ear and mastoid hair cells. So and tympanic membrane bulging you will see. So symptoms are excruciating earache. So in the tubal occlusion it was earache but not marked. Then you had throbbing earache, and in stage of suppuration, what do you have? Excruciating ear pain, earache. Then you have hearing loss is increased, and child may run fever, that is 102 to 103, high grade fever. Then you have vomiting and convulsions. So these are the symptoms. So earache, hearing loss was there in the first also. Then you added earache, hearing loss, and then you added like fever, high grade fever. So here you are adding earache, hearing loss, fever, vomiting, and convulsions. So extra 2 points you'll add this to. So then coming to signs, so your tympanic membrane will be red as usually, then bulging, loss of landmarks. So these points you'll have to remember. Handle of malaise may be engulfed. Yellow spot on the tympanic membrane where rupture is imminent. And X-ray of mastoid shows clouding of hair cells. So meringotum is indicated. So this is the stage of suppuration, because now in this stage patient comes to you, right? Like, so in this, what are the symptoms will be there? Excruciating earache, hearing loss is increased, and children, they have fever, high grade fever, vomiting, and convulsions. So signs will be the tympanic membrane is red, bulging, loss of landmarks, and handle of malaise will be engulfed. And you can see the yellow spot where the rupture is imminent. So like on the tympanic membrane, you can see the yellow spot. Okay, so there the rupture is imminent, and X-ray shows clouding of hair cells. So these are the points you'll write in stage of suppuration, very important. Then you have fourth is stage of resolution. So in stage of resolution, tympanic membrane ruptures with release of pus. Okay, so even nothing is done in this stage also, then what happens? The tympanic membrane will rupture and the pus will be released, and the subsidence of symptoms, the symptoms will be decreased. Okay, so inflammatory process will be resolved. So early treatment, resolution without rupture. So if uh, the stage of resolution will be there after stage of suppuration, but it depends. If treatment is given in the stage of suppuration, then there will be no rupture of tympanic membrane. But if the treatment is not given, then tympanic membrane will rupture and pus will be released. Then the symptoms will reduce, the inflammatory process will resolve. So what are the symptoms in this stage? Evacuation of pus, earache relieved, fever comes down. Okay, so it's like resolving all the symptoms. Okay, so pus will be released because of rupturing of tympanic membrane. So then there will be earache and fever. These two will decrease. And signs are external auditory canal may contain blood tinged discharge, later mucopurulent, and hyperemia subsides. Okay, so the external auditory canal may contain the blood tinged discharge. So last stage we have stage of complication. So we have acute mastoiditis, petrositis, and labyrinthitis, and facial paralysis. So intratemporal complications, and you have subperiosteal abscess, extradural abscess, meningitis, brain abscess, and yeah, so these are intracranial complications. So we'll study in detail about stage of complications, more about acute mastoiditis in the next video. So just know what are the complications, remember few. So you can remember this: itis, mastoiditis, petrositis, labyrinthitis, not meningitis. These three come, and facial paralysis comes under intratemporal complication. And you have subperiosteal abscess, extradural abscess, brain abscess, meningitis. So meningitis is intracranial complications. So we'll end with the treatment now. So what is the treatment you give for ASOM? So first is antibacterial, ampicillin 50 mg per kg. So ampicillin, and then you have, if allergic, if they're allergic to penicillin, you can give cefaclor, cotrimoxazole, erythromycin. And cefuroxime, acetyl or cefixime can be given. It's a therapy for 10 days. So antibacterial, first you'll write ampicillin, then you'll write if they are, yeah, so antibacterial, you'll give ampicillin, amoxicillin, cefaclor, codrimoxazole, erythromycin, cefuroxime, cefixime. So it's a therapy for 10 days. So one is antibacterial. Then you can give decongestants. What are the decongestants you can give? Drops, ephedrine, oxymetazoline, xylometazoline. So decongestants, you can remember this. Then you have analgesics and antipyretics, paracetamol. So that since there are fever will be there in many stages, so you can give paracetamol. Then you have ear toilet or oral toilet can be done. Then local heat is given. Myringotomy is indicated in the stage of suppuration. Okay, so incising the drum and evacuate the pus. So in stage of suppuration, there will be formation of pus. Okay, so you can do the myringotomy there. Then you have so the indications, when do you do myringotomy? If the bulging of drum you see, then you have incomplete resolution and persistent effusion. ASOM. So let us revise once fast. So ASOM, etiology, roots of infections, predisposing factors, bacteriology, then pathology of stage of tubal occlusion, symptoms, signs, then you have stage of pre-suppuration. So remember the symptoms, throbbing earache, then you have the tympanic membrane becomes red. So then you have stage of suppuration. Suppuration, there is formation of pus. So then symptoms, signs, then you have stage of resolution. Stage of resolution is evacuation of pus and resolving of the inflammatory reaction. Then you have stage of complication, intratemporal and intracranial. And last, your treatment, antibacterial, decongestants, analgesic antipyretics, then oral toilet, local heat and myringotomy. So this finishes your ASOM. Thank you.